From the Toronto Star, I'm Sabah Itazaz, and this matters. As the vaccines rolled out, along with another stay-at-home order, the rising ICU numbers showed us those who weren't getting the vaccines and didn't have the luxury of staying home. Ontario's essential workers have kept things running during a global pandemic. Since last year, more than 60% of all workplace COVID-19 outbreaks have all taken place in warehouses and factories. Now the province has finally turned its vaccine focus to the hardest hit neighborhoods in an effort to protect essential workers. But there are concerns that the postal codes and plans still do not match the reality on ground. So what could that kind of mass vaccination look like? Dr. Lawrence Lowe is here to talk about it. He's Peel's Medical Officer of Health. That's one of the hardest hit regions. Dr. Lowe recently took the lead on shutting down schools and declined 5,000 vaccines from the province for a shuttered Amazon warehouse, saying that's not how we can fix this. He's here to explain what's happened since. Later, the Star's Work and Wealth reporter Sarah Mushtahedzadeh is on this matters as well to answer some deeper questions about how we got here and why Ontario's essential workers paid a disproportionate price of a deadly virus. Hello, Dr. Lowe. Thank you so much for joining me today.
Thanks so much for having me.
Can you talk more about your decision to refuse those COVID vaccines from the province and the response you've seen since from the provincial government and from your community?
Well, I think, it was a very difficult decision at the time, but the reality is that we've been dealing with a period of significant vaccine scarcity. And in the course of having a period with significant vaccine scarcity, the province had identified a prioritization framework and also an ethical framework that was really vital to making sure that the doses that we had, the limited doses we had on hand, were getting to the people who needed it the most. At the time when we closed the Amazon plant in early March, we had only just started vaccinating 80 plus seniors in our community and across the province of Ontario. The provincial government had identified long-term care homes, Indigenous adults, and frontline health workers, as well as seniors in the community 80 plus as their priorities. And so when they reached out and said, well, the Amazon plant is closed, could we maybe give you 5,000 doses? Would that get the plant up and running again? First of all, the transmission had gotten so widespread in the facility. That was what necessitated it to be closed for 2 weeks to really ensure that all the chains of transmission were broken so that those immunizations would not have helped bring the plant back earlier. But I think the other thing that really went through our mind at the Region of Peel was, we haven't even gotten to our seniors in accordance with the province's framework, and they're the ones that are at greatest risk of death or dying. What are we doing here in terms of bumping Amazon to the front of the line with doses that may not work? So I guess to the extent that it was a very different time in early March, I'm really glad that our supply has improved to the point where now the conversation has shifted to how can we tactically deploy vaccines to really stop some of the transmission amongst essential workers in hotspots such as ours in Peel.
Speaking of that, Dr. Lowe, Ontario is now moving to expand vaccine rollout and eligibility in hot zone neighborhoods, which is presumably to help essential workers, to help protect them. As a medical officer of one of the hardest hit regions, how do you see this being implemented? What should a vaccination program for essential workers look like? And is the provincial government working with you on this?
Oh, we're working very closely with our partners at the Ministry of Health and the provincial government. I think it really is a combination of multiple tactics and strategies to get to the populace and to really get through this as quickly as possible. Interestingly enough, the Region of Peel, the vast majority of our postal code areas are considered a hotspot. So that means that the existing mass vaccination fixed clinic system at our hospitals and our community centers will continue to serve people who live in hotspots, and it will do so very efficiently and effectively. On Saturday, just this recent Saturday, April the 10th, we actually saw our highest vaccination total across our entire system at nearly 12,500 vaccines delivered in a single day, which means that out of our entire community through our mass community system, with adequate supply guaranteed, we're vaccinating 100,000 people a day, all of whom live in high-risk postal code areas. But we do know that that's not going to be enough to get to some of the hardest to reach populations. And so we're working with local chambers of commerce and local businesses. We're also working with our local hospitals and community agencies to figure out How do we do pop-up clinics? We've already been doing mobile pop-up clinics in seniors apartments and apartments with high proportions of seniors. We're looking to pivot that aspect of our program and then expand on it with additional resources to try to get to, temporary and agency workers, international students, people who live in some of the harder to reach areas in our community so that they're also getting vaccinated in parallel to what we're seeing through our mass immunization program.
Are there any more details on which essential workplaces would get vaccinated first? Are you developing a criteria for that?
We definitely have a criteria in mind. A lot of it has to do with obviously the size of the workplace, evidence and data around risk, particularly any historic evidence we have or current status and outbreak, and also just what we know about the nature of how we can access that facility, whether it's, for example, an organization that's able to vaccinate their own workers versus whether we would need to provide the resources, et cetera. As you can understand, there's obviously far more workplaces out there than there are resources to actually deploy. So to the extent that we're still also going to be trying to push arms to needles through our mass immunization program, we have great community agencies that have they're getting the vote out by driving people to these centers, having transportation networks, and really trying to increase vaccine confidence in attending at a mass vaccination center. But like I said, some of the criteria we apply are previous outbreaks, data and evidence from other jurisdictions, as well as really like the size of the workplace and potentially the characteristics of the surrounding community that might be supported by a pop-up. I'll also add, in addition to focusing on workplace vaccinations, we also know that there's opportunities for community vaccinations in places of worship and community centers, in particular hard-hit neighborhoods. And we're actually thinking that might also be a very open and equitable way to really ensure that it really is about the essential workers and making sure that they get access to the vaccine ahead of others who may be at lower risk.
Dr. Lowe, going back a little bit, you were among the first to take the difficult decision to shut down schools and deviate from provincial guidelines to protect the community. Do you see more of that kind of tough decision making at the local level?
Well, I think it's driven by the local level and the community. Ultimately, what we were seeing in Peel with the resurgence of a third wave was really challenging a lot of the measures that we had in place in schools. And while schools have remained safe with the measures and the safety protocols that have been put in place, those safety measures have a threshold. And because Peel had always been a high transmission community, we got to that threshold sooner than elsewhere. But I really do think this is the fundamental strength of Ontario's public health system. You have a check and balance between the province and the local level where, certainly the province, they will take their perspective on what they're seeing across Ontario. But at the local level, you have a health unit and you have a physician who understands what they're seeing in that community and is able to act decisively to address any potential risk.
But do you think the provincial government framework has gone far enough to address the situation? Over time, how do the provincial guidelines differ from the public health units over time and now as well?
Well, I think to the extent that the province has the challenge of trying to balance, numerous different communities in this very diverse province of ours. And I can share, when I was in med school, I did a family medicine rotation up in Kenora. I was in Windsor, Ontario at the time, the University of Western Ontario, and I grew up in London, Ontario. All very different communities, very different places. Windsor, they were always worried and lumped into emergency exercises across the border. So I find it very interesting. Of course, the province has to balance all that. And so their framework will necessarily cover some of, but not all of the needs that we may be seeing and we may be encountering at the local level, which is why you really do need to have that check and balance, that local knowledge to be able to supplement and ensure that communities are being kept safe, both in emergency situation and also when it's not an emergency situation. The health of community is very dependent on knowing your community and the diversity and differences that exist within it.
Keeping that in mind, now that things have changed a bit, do you still think there's time to get ahead and on top of this? And how hopeful are you that this can happen?
I think we're taking the exact same strategy and playbook that other jurisdictions that have gone before us have seen. Both Israel and the UK encountered a significant rise in a third wave driven by variants of concern just prior to their vaccination program actually reaching its zenith. And I think it's the same thing here. We know that we can't vaccinate our way out of this third wave. Our population is still susceptible, and it's just, we can't outrun how fast the disease is spreading right now. But I think with the measures that we have in place, with the continued monitoring and work by local public health units with our province, we can essentially follow the same playbook of close, vaccinate, and hopefully exit on the other side. So I feel a little bit of hope, even if it does feel very difficult right now. And certainly our thoughts and prayers are with those that are fighting this on both sides of the bed rail and our hospital systems, and also with our small businesses that have been impacted with this, and those that are waiting for their turn patiently for vaccination as our vaccine program rushes to catch up with them.
Dr. Lowe, I know how busy you must be. Thank you so much for taking time out to talk to me.
Thanks so much for having me.
That was Dr. Lawrence Lowe, Peel's Medical Officer of Health. We'll be right back. The Star's Work and Wealth reporter Sarah Mushtahadzadeh joins me now to talk about Ontario's essential workers and how they need to be protected. Hi, Sarah. Thanks for joining me again.
Thanks. No problem.
So, Sarah, I know it's been a process acquiring this data while reporting. So, using that to start off with, can you talk a little bit about who exactly is an essential worker in the GTA? And is there an estimate of just how many there are?
Yeah, I think that's such a huge and important question because, we have our provincial authorities talking about lockdown. We have to ask, what does that mean and for who? And so earlier this year, we went through the regulations and looked at what City of Toronto GTA data told us about which workers were impacted. And what we were able to figure out from that is that 65% of workers in the GTA are in sectors that are designated essential. And that's around 2 million people. So I think it's really important to acknowledge that when we talk about lockdown, it doesn't apply to the majority of workers in our city who are in sectors where they do have to go into work, or at least their employers are empowered to ask them to come into work. And in many cases, warehousing and manufacturing being two of the main ones, the lockdown restrictions do not apply at all. It doesn't matter if you're manufacturing chocolates or, auto parts, it's all considered essential.
And you mentioned warehouses and manufacturing. I was going to ask you if you could give us a snapshot of the essential workers and sectors that have been the hardest hit by COVID and a little bit of the kind of working conditions that they would be working under.
Yeah, and that's the other really important piece of this is who is most likely to be excluded from these lockdown regulations. And when we dug into that, the data showed that these workers are more likely to be immigrants to Canada. They're less likely to be unionized, and they're lower wage workers on the whole. There are, of course, some exceptions to that. There are some parts of the manufacturing industry, for example, where there are high unionization rates, where the wages tend to be a bit higher. But when you look at sectors like warehousing, where there have been some considerable outbreaks, only 8% of workers in that sector are unionized. The overwhelming majority of workers are new Canadians. 80% of workers in that sector are based in Peel, which is one of the hardest hit COVID regions. And we know that many of these workers are racialized. And so it really just shows the disproportionate impact of the pandemic and how this is playing out for low-wage racialized communities.
Ontario announced shifting vaccination priorities and expanding eligibility towards the hardest hit neighborhoods recently, but there's a lot of questions about what's happening on ground. Can you talk a little bit more about the changes around phase 2 of the vaccination strategy and whether this is a step towards protecting the most at-risk essential workers?
Yeah, I think that in many ways, the move to expand eligibility criteria in hotspot zones was a critical step forward in the eyes of many experts. It was absolutely the time to do that. I think now the question is, what is that going to look like? And that's where we have very little detail and very few answers. What we know is that if you're an essential worker in a hotspot area, you are eligible to get the vaccine, but the delivery will be through these pop-up and mobile clinics. And, we don't really have much more detail in most postcode regions as to what that's going to look like. I believe Halton is the only region to specify which workers and which sectors will be prioritized. And in that region, it's going to be teachers and food manufacturing workers who will sort of have first access. In Peel, we know that Amazon has offered its warehouses as a potential workplace vaccination site. But other than that, there's no detail at all around whether and where there will be workplace vaccination clinics other than to say that the government has reached out to about 500 employers to sort of encourage some kind of workplace vaccination activity. But at this point, very few details from any of the health units about what this is going to look like.
So at this point, outside of the Halton region, there seems to be no categorization or criteria for which essential workplace might actually be considered first in this, right?
Yeah, we really have no idea. All of the health units that I've spoken to so far that do have hotspot areas within their kind of catchment area have said that they don't have details at this point. So yeah, we're still waiting to hear which workers are going to be prioritized. And of course, there are going to be tough decisions to be made because we don't have the vaccine supply yet to do all of the sectors that have been designated essential.
So looking at the best case scenario, I know you've talked to a lot of people about this. What are some of the ways that public health experts suggest that this vaccine rollout can be the most effective and equitable? What can be done?
Yeah, I think it's going to look different from health unit to health unit based on, what kind of workplaces are concentrated in their jurisdiction. Peel, for example, we know that there's a huge warehousing and distribution industry. So that will look different to Windsor, for example, where, there's a large population of migrant workers. But in terms of what sort of factors to consider, we're talking about environments where it's difficult to socially distance. That's one of the factors that, experts are encouraging authorities to sort of prioritize, because obviously that's a higher risk environment for workers. They might want to look at the history, outbreak history. They might want to look at the size of the workforce. And then there's a whole host of other factors that, experts say led to this inequity in the first place, that the ingredients, as one person put it, to creating these hotspots. And that's really around, the conditions of precarious work. So access to paid sick days, access to health benefits, whether there is a heavy reliance on temp agency workers, all these things that can be potential risk factors in terms of spreading this virus, and to the workers themselves, being able to remain safe on the job.
I'm glad you brought that up while we are talking about vaccinations, which are essential to bring to these work sites to protect essential workers. But there's also an urgent need to shed light on the structural issues that prevail that you already mentioned.
Yeah, and I think that's one thing that's come out clearly in what health and labor advocates are saying, which is it's essential, of course, to get the vaccine to essential workers, but vaccinations are not going to solve the underlying problems. Those are policy interventions. Those structural changes require policy changes. And so, as we've been talking about for months now, many of the calls have centered around access to paid sick leave, around workplace inspections and enforcement, the things that allow workers to empower workers, in other words, to keep themselves safe. And, I think that there is, while this expansion of eligibility in terms of vaccinations is absolutely welcome, we're at a place in the pandemic where I think a lot of experts want to see some of these more institutional social changes as well.
And paid sick leave has been one of the top things that has been discussed in that context. How have labor advocates responded to the way Premier Ford treated the question of paid sick days, saying it would be a repeat of a federal sickness benefit program? That's not the same thing at all, is it?
Yeah, the Ford government's line for months now, again, has been that paid sick days are a duplication of the temporary retroactive federal sickness benefit. And you just need to look at the description of how the federal program works to see that the structure is different than what advocates are calling for in terms of a provincially legislated paid sick day. And so I think there's a lot of frustration and anger around the response from the provincial government, because a paid sick day is about immediate, seamless access to a day off if you have the sniffles and you need to go get tested to see if you have COVID at no loss of income. That's what a paid sick day that is legislated by the provincial government accomplishes. The federal program provides retroactive income support with a variety of eligibility criteria. It doesn't provide that immediate day off so that you can just check that you're not going to get your colleagues sick. And so I think that's where the frustration comes in, is feeling like the response is not accurate from the provincial authorities.
Sarah, is this a time of reckoning? What we've been seeing playing out since last year, has that also in a way drawn more attention and refueled workers' rights movements?
Yeah, I think that's a really good question. I mean, I've been reporting on these issues for more than 6 years now, and this pandemic has just really exposed the realities of low-wage, precarious work, I think, in such a high-profile way. I do think it's a pivotal kind of moment that is forcing us to confront realities that are often kind of swept under the carpet. I think that workers, advocates, and organizers are not just using the moment to demand the solutions that have long been on the table, but also to create relationships with healthcare experts, for example. You know, you're really seeing a convergence of people from all different expertise or areas of expertise that are calling for the same things now. And I think this is the first time, certainly since I've been covering these issues, that I've seen this amount of kind of consensus. So I do think it's a really interesting moment for the labor movement.
Thank you so much, Sarah. It's always so insightful to talk to you.
Thanks so much.
I was talking to Toronto Star reporter Sarah Mushtahedzadeh. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabah Itazaz, Adrian Chung, and Raju Mudhir. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So-Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.